In this video, external and internal anatomy of right atrium will be discussed. This is the external surface of right atrium. It extends from superior vena cava orifice to the inferior vena cava orifice. The right atrial appendage covers the right side of the ascending aorta, and it is close to the right coronary artery. The right atrial appendage is broad, triangle in shape, and has wide junction with the right atrium. This is the sulcus externally, called sulcus terminalis, extending between right sides of the opening of the two vena cava. Sulcus terminalis internally corresponds to crista terminalis. The interior or the cavity of right atrium is divided into two by crista terminalis into smooth sinus venarum and rough atrium proper. The crista terminalis is smooth muscular ridge which runs along the right lateral wall between the two vena cava opening. The chamber anterior to crista terminalis is called atrium proper. The surface of atrium proper is rough. It is due to the presence of pectinate muscles. The pectinate muscle originates from the crista terminalis at right angles, and it runs across the atrium proper to reach the right atrial appendage, where the pectinate muscles combine to form thick trabeculations. Atrium proper develops from primitive atrium of the embryonic heart tube. The part of the right atrium posterior to the crista terminalis is smooth, and it is called sinus venarum. This smooth venous part of the right atrium develops from sinus venosus part of the embryonic heart tube. Sinus venarum receives the venous blood from superior vena cava, inferior vena cava, and coronary sinus. The opening of the inferior vena cava is guarded by a flap-like valve called Eustachian valve, which is anterior to the opening of inferior vena cava. Laterally, the Eustachian valve joins with the lower end of the crista terminalis. The Eustachian valve has major role during fetal life, as it directs the richly oxygenated blood from placenta to the left atrium through the foramen ovale. The opening of the coronary sinus is also guarded by a valve called Thebetian valve. The Thebetian valve joins with the Eustachian valve laterally. At this junction, a tendinous structure called Tendon of Torado runs along the septum to insert into the central fibrous body. A triangular zone called Triangle of Koch is of surgical importance, as it's an anatomical landmark for atrioventricular or AV node. The Triangle of Koch is formed by the tricuspid septal annulus anteriorly, Tendon of Torado posteriorly, and base is formed by the coronary sinus. At the apex of the triangle lies the AV node. Right atrium is separated from the left atrium by interatrial septum. The features of interatrial septum of the right atrial side includes fossa ovalis, which is a depression in the interatrial septum formed by the septum primum embryologically. The rim of the fossa ovalis is prominent, which is formed by the septum secundum. This rim is deficient inferior to the fossa ovalis. The viewers are requested to watch the development of interatrial septum video for further details. There is a prominence in the interatrial septum superior and anterior to the fossa ovalis. It is called torus aorticus. This is formed by the aortic root, and it marks the location of the non-coronary cusp of the aortic valve. We complete the video here. Hope it was useful and see you soon in the next video.